Black healthcare providers and Black health advocates like myself have been sounding alarms, pushing for institutional change, caring for patients, and bringing knowledge where there was little since early in the COVID-19 epidemic and since African Americans were first brought to these shores. Their legacy of stepping into the gap manifested vividly on social media platforms over the last few weeks. My hope is that you also saw what I call these COVID vaccine love shots. Every time I turned on Twitter or Facebook, I saw them. Black professionals of all types getting the COVID shot, sharing their relief, and encouraging other Black people to do the same. With hashtags like right to bear arms, this is our shot, get the shot, they smiled and reassured. Overcoming her own fears, a Black school nurse was the first of her colleagues to step up. Someone has to tell them it's okay, she told a reporter. A young doctor's message, let's keep spreading the word. We need to protect us and make sure enough of us get this shot, y'all. This flood of individuals speaking in one voice was profound. It said, I understand your fear. Hope is on the horizon. It said, I wouldn't advise you to do anything that I'm not willing to do. The voice said, Black Lives Matter. It was as if a metaphysical agreement had been made wherein Black doctors and nurses and others decided to put their reputations and their privacy on the line to save us. Because whether or not one is vaccinated is a personal health decision. Moreover, vaccines are largely developed by big pharma, a term often associated with ridiculous prices, the opioid epidemic, and those lawyers who come on late night TV to encourage legal action. But these Black professionals were not selling out. They were not getting kickbacks to pose with needles in their arms. No, they were educating and advocating for what they knew would save lives and reduce suffering. This social media wave was preceded by the presidents of the 4 historically Black medical schools, who in September penned a statement encouraging Black, Indigenous, and other people of color to participate in COVID vaccine trials and committing to protect the members of our communities by maintaining the highest standard of integrity and respect related to those trials. Several months before this was the love letter from Black doctors and nurses, many of whom took part in those clinical trials. The love letter said, in the spirit of unconditional love for every single Black American, we have locked arms in an initiative to put the health and safety of our communities at the center of the national conversation about COVID-19. And it urged Black communities to take safe and effective vaccines once available. There's something beautiful about the way that so many professionals have united around this cause. Of course, it is these health providers who have seen the grave toll that the COVID pandemic has taken in their hospitals and clinics, families and neighborhoods. But pandemic or not, Black people experience excess death and disease that is preventable. And after COVID, we need to uplevel images and voices of trusted providers and others as they role model actions that community members can take to protect their own health. Such campaigns could encourage higher uptake of treatments for cholesterol and hypertension, because more Black Americans die of cardiovascular disease each year than of any other type of disease. They could boost efforts to encourage people who are living with HIV to get and stay on treatment, and for those at risk to take PrEP, a pill that can prevent HIV infection. We need such efforts for the HPV vaccine. We have a vaccine to prevent several cancers, but fewer than half the young people who should get it do so. Think about that. We have a vaccine that prevents cancer, but most people are not getting it. Despite the fact that we die of all of these conditions at a faster rate than whites do, Black people are less likely to receive vaccines or to take and adhere to treatments for the conditions. There's no simple why for this disparity. I cannot underestimate the need for system-wide changes to level this disparity, but these smiling, imploring, and beautiful Black faces are also key. In my work on medical mistrust, we consistently hear that part of how healthcare institutions gain the trust of people of color communities is by hiring members of those communities to serve patients. As Nurse Jason Harrison said on Twitter, "Who am I? I'm nobody. I'm your cousin, I'm your boy, I'm your son. It doesn't matter. But I know that I'm the person who, when I walk into the hospital and go into the rooms, the person in the bed looks at me, sees a face that looks like them, breathes a sigh of relief, and says, oh, good. At least I know I'm going to be taken care of today." We want to trust that we will be taken care of. Reluctance to take the COVID vaccine is high in Black communities. Some of us have said no way. Many others have said that they want to wait and see, let others go first. This is understandable. Vaccine development was swift, and the currently approved messenger RNA vaccines are based on a technology that is new to vaccines. Furthermore, vaccine development fell under a plan called Operation Warp Speed, not the best phrase for engendering trust. And of course, our reasons for mistrust started way before 2020. It was passed down through our DNA from grandparents and great-grandparents who lived in communities where hearses once doubled as ambulances, and people who went to hospitals often did not come home at all. Those Black professionals on our social media feeds know this, but they also know a challenging paradox, that a small but real part of why our communities experience poorer health than whites do is because we sometimes avoid, delay, or refuse medical care and treatment when it could benefit us. It's because we sometimes let fear dissuade us from the very thing that could optimize our health. So now that I've shared with you what I call love shots, taken of healthcare providers getting vaccinated for COVID on camera out of love for you, I want to share with you the knowledge that helped them to make that choice. I want to start by talking about Operation Warp Speed, which was designed not only to develop and test, but also to produce on a very fast timeline, millions of doses of the new vaccines. This process was first sped up by conducting simultaneously some of the vaccine trial phases that would normally happen one after the other. It's not that steps were skipped, but they took place concurrently instead of one after the other. The high rates of the COVID vaccine cases also allowed for the trials to be conducted quickly because so many people were getting infected. The trials were quickly able to see differences in risk of disease between those who received the vaccine and those who did not, those who were in the arm that we call the placebo arm. Finally, as I said, under Warp Speed, the government and others invested into building the manufacturing capacity to produce large numbers of vaccine doses before findings of the phase 3 trials were available. They knew they would have to throw out those doses if the vaccine was not found to be safe and effective. So fast is not necessarily bad. I want to assure you that all of the regularly required steps for vaccine testing and approval were still followed. The criteria for determining that the vaccines worked, in other words, were efficacious and were safe, remained high. And the safety and efficacy data for the vaccines that currently have emergency approval are quite strong. Finally, it's important to recognize that vaccine developers had a big head start. You see, SARS-CoV-2, the virus that causes COVID-19, is a member of the coronavirus family, of which there are hundreds. These viruses also caused the SARS pandemic in 2002 and the Middle East respiratory syndrome epidemic in 2012. So although the COVID-19 disease has been with us for just over a year, and researchers started the vaccine development specifically for the SARS-CoV-2 virus when that was first identified, they had been working on vaccines for very similar viruses since 2002. That's 18 years of research that went into development of the current vaccines. And as I said, these vaccines work really well. Both the Pfizer-BioNTech and the Moderna vaccines are said to be about 94% effective. I shouldn't say said, I've read the studies, I've looked in detail at the data, and you can see by the graphs on the right, the rates of infection among people who didn't get the vaccine, who are shown in brown, and people who did get the vaccine, shown in light blue. Rates of infection of people who didn't get the vaccine were about 19 times higher than rates of infection of people who did. We can compare this 95% efficacy to the flu vaccine, which is about 40% effective. The vaccines also appear to be safe. Yes, there are side effects, but they tend to be fairly minor. The most common are things like soreness, fatigue, aches, and they don't last more than a day or two. Serious reactions have occurred, but they're rare. And you cannot get COVID from these vaccines or any of the other vaccines that are under development. We also have to think about this in terms of benefits and risks. There have been a few severe allergic reactions that have occurred from the vaccines, but these have affected about 1 in every 90,000 vaccinated people in the US. There have been a very small number of Bell's palsy cases. It's not yet clear these were because of the vaccine, but again, this has been less than 10 people so far. There have been no deaths associated with the vaccines anywhere in the world, and we can compare these risks to the nearly 400,000 people that have died of COVID-19 in the United States alone. So what does it mean to wait for those who want to wait and see? That often makes sense, but not necessarily when you're in a burning building. In the first week of 2021, 2 people in our country died of COVID-19 every minute of every day. By the end of this talk, another 24 people will have died. I, for one, am afraid to wait. And as you can see, COVID-19 death rates in LA County currently exceed rates from all other causes combined. So I will close with my parting shot and a reminder that when it comes to vaccines, we don't have to choose fear or faith. We have another choice. We can choose knowledge, and we can choose to follow the example of those role models who have always cared for us. In doing this, each of us can serve as models of health for those around us. Thank you.